The HIV/AIDS epidemic was really powerful because it made it was a global phenomenon that was happening. And so there was this idea that if you were born in a rich country or if you were a citizen in a rich country, you would get access to this newly discovered treatment. While if you were part of a poor country, then you wouldn't be able to get access to it because you couldn't afford it, right? So that, in a way, to go across countries, you had to talk about it in terms of human rights. So within a country, you would talk about it in terms of some sort of citizens' rights to equal access to healthcare. But in terms of a global conversation, you would say that everybody has a human right to access to medicines. And so in South Africa, what happened was that a private citizens group, made a legal case saying that everybody in the country who is affected by HIV should get access to HIV medications, right? That was because the government at that time was not providing medications. And so they sued the government and says, you have access to medications if you have a particular disease. So that legal precedent for AIDS medications in South Africa then compelled a whole other kind of conversation, particularly around the negotiations between the Clinton Foundation and various pharmaceutical companies about reducing the price of pharmaceuticals so that different countries, particularly developing countries, could get access to medications. So that's how it became a human rights issue, the access to medicines. Before HIV/AIDS, we didn't really talk about access to medicines as a human rights issue. So one way of thinking about a human right to access to medicines, or let's just call it a right to medicines, right? So a human right to medicines. So let's, in a simple way, say that it's about a human right to HIV medications or AIDS medications. So can we just simply transpose that language or those ideas to other diseases, say like cancer or like tuberculosis or like other kinds of stuff? So some people do want to make the argument that this is not just about a right to specific medications, it's about, say, right to medications that you need based on your whatever disease that you have. So anybody should be able to access the drugs that they need in order to treat their disease. But there are different kinds of issues involved, right? So because it's not simply access to AIDS medications. What you really want is you want access to the best available treatment to your disease. Yeah. And so if that part of that treatment is some sort of medication, then that would be one part of it. So a lot of people might be kind of hurting themselves if they truncate their argument to simply right to medications or right to medicines, when what they're really interested in is the right to treatment for their disease. Before the early 2000s, people really thought that a human right to health was just a nonsense idea. How could you possibly have a right to be healthy? And how could any state really guarantee anyone's health, right? So there's so many factors involved and stuff. So what happened, and with Article 14, I don't know if you're familiar with Article 14 that was published by the Committee on Economic and Social Rights. Article 14 was the first time that a general comment or a discussion about what is entailed in terms of a human right to health and what are states' obligations in relation to the health of citizens. And it laid out a bunch of different kinds of components to it. And what was interesting about that discussion is that they said, we recognize that health is not just about access to clinical medical care when you're sick, but health is also about access to the conditions that promote health, right? So at that time, what they were saying is that a human right to health entails not only access to treatment that you might need, or also preventative clinical care, but also the conditions such as clean water, safe housing, being free from abuse and violence and all that kind of stuff. So the national government's obligation to health is really quite broad. It's both to providing a good healthcare system that's functioning, that's sort of being able to protect individuals and communities, but also to work outside of the healthcare system in order to provide the conditions. So the people who wrote this general comment is a German lawyer named Iber Rudel, who was the one who sort of kind of moved this forward, was very cognizant of the fact that he didn't want governments to dismiss this as being rhetoric or empty dream. So his arguments are based on all the years of testimony that governments have already given in front of the committee about the work that they've done around health, so that this is simply an accretion, a picture of what's so far been accepted and reported, not some pie in the sky kind of stuff. So the kind of work that I do is much more pie in the sky kind of stuff, basically making a theoretical argument that this is what justice demands about what governments should be able to do and what they're not to do. So following up on that, we're coming to a world in which governments are not the most powerful actors in the lives of individuals. So 50 years ago or so, we thought that the state was the most important agent or institution in the lives of citizens to be able to impact their well-being. So aside from themselves, the schools, the hospitals, the work, so all these kind of things were sort of determined by the state. But now we're living in a world in which many countries, particularly in developing countries, the state is often weak, it's not working, it doesn't exist, or more and more the state has been taken over by private enterprise, and more people are relying on private entities. And so human rights now are not just about what does the state owe its citizens, it's what are all the people in society around, like what are the obligations and duties of all the people in a society towards the health of people.